Welcome to this episode in the section of mental health in the series of holistic health. In the last episode, we saw certain symptoms which are indicative of mental ill health. In today's episode, we will talk about one of the commonest of this mental ill health, and that is major depression. Usually, what we understand by depression is the reactive depression. When the situation is adverse and we become depressed, like say somebody fails in exam and is sad, or somebody is doing poorly in his business and is sad, or some near and dear one dies and the person is sad. This is what we understand by depression. This is the reactive depression. The major depression is not a reaction to life event, but it's a depressive illness, which is caused because of the neurotransmitter serotonin decreasing at the junction of the nerves. This illness is characterized by midnight insomnia or late night insomnia or even total insomnia. In the morning, the person feels dull, is not refreshed. The dullness will last for some time, maybe 5-10 minutes, maybe half an hour, maybe 2 hours, maybe till noon, maybe till evening. The longer it lasts, the more severe is the illness. And as the person recovers under medication, this duration of the morning dullness starts reducing. Earlier, maybe it was till evening, now it is till afternoon, then for just 2 hours, then just for half an hour, and then 5-10 minutes, and then it goes away. This is the indicator of the person recovering. The implication of this is that in the morning, because he is feeling dull, the person refuses to go to the job, to the shop. In the evening, he is feeling better. And therefore, he can go out for a walk or to the movies. So the relatives don't understand this. And they say, this fellow is shirking responsibility. He is not doing that. He just can't do it in the morning. In evening, when he is feeling better, he may resolve, yes, tomorrow I'll do this. But when the morning comes, he's down and cannot attend to it, though he wants to. So morning dullness lasting for varying periods of time is a very sure sign of this illness. Second important symptom is lack of appetite. The person just doesn't feel like eating. And this anorexia is more for breakfast and lunch. Because the illness becomes better by evening, he can have dinner properly. So this is a diurnal variation mood. The person is worse in the morning, better by evening. The person will have even panic attacks of varying duration, of varying frequency, which is again a manifestation of this major depression. But the core classical symptoms of this illness are feeling sad without any apparent reason, feel like crying, and have crying spells, which is very embarrassing to the person, but he just can't help it. The person feels like crying and he feels ashamed of crying, but he just can't hold back the tears. And the most dangerous symptom is suicidal ideation. The person doesn't feel like living. He wants to end his life, to end his agony. And in extended suicide, he also takes the lives of his near and dear ones to spare him the agonies of life. The person just doesn't feel like doing any work, keeps on postponing, or has to force himself to do work, feels weak, feels tired. There is intolerance to noise, there is irritability. And very often, there are obsessive thoughts, unwanted thoughts that keep on coming in the person's mind. The person may even take to addictions because he is feeling low, he wants to raise his spirits, and for that he may take the help of the alcohol. So this is sort of a self-medication. He is trying to come out of it, resorting to this. And once he's hooked to it, he can't give it up. So many a times, alcoholism is secondary to this major depression. There are some symptoms which pertain to the body. These are called autonomic symptoms. Like there is dryness of mouth or there is constipation. And very often there are digestive symptoms. The person has acidity, constipation, diarrhea, or flatulence, gas. This is because all the processes during this illness have slowed down. Talking, walking, even meditation, that is thinking. At the same time, the digestive process is also slowed down. So what happens? The food remains for a longer time in the stomach. And that is why there is more fermentation, leading to acidity and gas formation. However, the person is not aware of it, so he will approach a gastroenterologist. And all the investigations turn out to be normal. Ultimately, the person is relieved through the antidepressants. Another common physical symptom is headache, particularly feeling heavy at the center of the head. Some other somatic symptoms also include vague aches and pains all over the body. So backache, joint pains, and they don't respond to any other treatment, but when you start the antidepressants, they go away. Very common symptoms are feelings of hopelessness, helplessness, worthlessness. The person feels he is no good and not worth living. There is also blankness of mind, and the person is unable to marshal his thoughts. And that's why he finds it difficulty in taking decisions. Because of the lack of concentration, there is forgetfulness, giving a false picture of dementia, what we call pseudo-dementia. So the forgetfulness can be reversed with the help of antidepressant medication, unlike in dementia. Along with these obsessive thoughts, there is also negative thinking. One important symptom is of guilt. The person unnecessarily feels guilty about some wrong that he may have done in the past, and therefore very often feels that he is justified in having these symptoms. There is decrease in sexual drive, not interested in sexual activities. And when this depressive illness becomes very severe, it can lead to delusions also. The important types of delusion that you see in a depressive illness is delusion of poverty. The person may be very rich, but he feels he is poor and cannot afford even the basic amenities of life. Like one of my patients who was stinkingly rich told his wife to cook only one meal a day because they cannot afford 2 meals a day. Delusion of poverty. Then there are delusions of guilt. The person feels guilty about some minor offense he may have done in the past and has a lot of remorse over it. Then there are nihilistic delusion, in which the person feels he is dead or some of his organs are destroyed, that the intestines are rotten or there is no heart. Then some people may have hypochondriacal delusions. They feel that they are suffering from some major illness like cancer or HIV, and they undergo several investigations which are negative, but it doesn't convince them. And these delusive symptoms will occur when there is a severe intensity of the illness. The usual age of onset of this illness is around late 20s, early 30s. But since last many years, we have observed this even in children. Sometimes this occurs after the age of 60 in both males and females, which is called involutional melancholia. In women, this can occur after delivery, postpartum depression, or after menopause, postmenopausal depression. And they are occurring because of the hormonal changes that are taking place in these periods. Here again, the management would be the same. Another condition usually seen in women is PMS, premenstrual syndrome. Because of the hormonal changes that take place around menstruation, there are mood changes. The person feels irritable. The person may feel sad. Now, this is because of water retention due to the hormonal changes. And the best treatment for that would be a diuretic to remove the excess water from the body. And the best natural diuretic is coconut water. So, as soon as you detect the signs of PMS, the person should start coconut water so that more and more fluid is withdrawn from the body and the PMS come under control.
So every woman or every girl who experiences PMS, does that mean she is prone for depression?
Not necessarily. But it may happen that the person may have both depression as well as PMS. In which case, the symptoms of depression will be aggravated during the premenstrual phase.
So in such cases, only coconut water won't be helpful, obviously.
Yes, there you'll require the antidepressant medication.
During the pregnancy also, they say that, the mother gets depressed. So there also medication is required or
Depends.
constant?
How severe is the illness? If the person can pull on, usually in pregnancy we try to avoid the medication because we do not know what effect it's going to have on the
child.
fetus. Especially so during the first trimester. After the first 3 months, we have to weigh the severity of the illness and the necessity of medication. However, if the medicines are required, then there should be periodic checkup with sonography to detect whether it's harming the fetus or not.
Sir, if a person is sad since 3-4 days because of some breakups or some business losses, does it mean that he is in depression?
These are reactive disturbances.
Okay.
He is sad because of some adverse situation. So it is an emotional ill health. And how to deal with that, we have seen in the previous section when we dealt with emotional health
Okay.
through psychotherapy.
Right.
So that he is not upset by these adverse situations. When this persists for a little longer time, you will call it a reactive depression or neurotic depression. What we are talking right now is about major depression, which is a depressive illness caused because of neurotransmitter imbalance at the junction of the nerves, not because of any situation.
So it is not a clinical illness.
It is not a clinical disease. So let me take this opportunity to tell you the difference between reactive depression and major depression. In reactive depression, there is some cause in the environment because of which you are upset.
Okay.
In major depression, there is no cause. However, you may blame something or the other in the situation or in the event for your depressive feeling.
Got it, sir.
The cause being in the environment, the onset is acute, sudden. In endogenous depression or major depression, you don't even realize when the depression has creeped in. It's insidious. In reactive depression, usually the person is better in the morning, worse in the evening. Whereas in major depression, reverse is the case. The person is worse in the morning, better in the evening. By and large. There can always be exceptions to the rule. In reactive depression, the mainstay of treatment is psychotherapy. In major depression, the main treatment is medication. In major depression, there will be autonomic symptoms like dryness of mouth, constipation, etc. In reactive depression, there are no such symptoms. So, just because the person is feeling sad does not mean that is suffering from major depression. Other symptoms like lack of sleep, should be seen. Of course, in reactive depression also there will be lack of sleep, but that will be of the early night type. Whereas in major depression, you will have midnight or late night or total insomnia. In both, there will be lack of appetite. In major depression, there would be diurnal variation of mood, and that's why mornings are worst. That's why the lunch and breakfast are less. So these differences between the two should be able to help the person to judge whether the depression or the sadness is because of a situational factor or is it an illness, so that the person can take appropriate remedial measures. So in the present episode, we saw the clinical manifestations, the presentation of major depression. In the next episode, we shall take some questions regarding this illness.